You've advised 7 presidents, from Ronald Reagan to Joe Biden. What lessons have we learned for the next pandemic from everything you've seen over all these years?
The lesson is that pandemics occur. They've occurred long before history recorded it. They've occurred while history recorded it. They've recurred in our lifetime, and they will continue to recur. You can't predict exactly when. And there are some lessons, because the kinds of responses to a pandemic, a scientific response and a public health response. What worked well for us was the scientific response. The investment we made in basic and clinical biomedical research allowed us to get a vaccine available for people within 11 months of the identification of the virus, which is beyond unprecedented. We've never had anything like that. It usually takes several years. That was a scientific and logistic accomplishment. The thing that didn't do as well was what we thought was good public health preparedness, and we've got to do better to modernize the way we get data in real time, as opposed to being a month or 2 or 3 behind what's happening. Those are the things that we've got to really do better at.
Have we learned something about the cost of keeping kids home from school? Would you do that differently?
Yeah. Well, certainly at the time that we had to shut down, you have to shut down for a very, very finite period of time. You don't want to extend that beyond what is necessary. As you know, after we started getting children back, I was very vocal in doing whatever we can to get the children back to school safely. That's really what we needed to do. Yes, there are collateral effects of keeping children out of school, but there are also collateral effects on children just on the basis of the outbreak. You know, the stress in society, people losing their grandparents, sometimes their parents. Those also have a great effect on children.
What have we learned about the National Strategic Stockpile? Is it in better shape now for PPEs and ventilators and vaccines, obviously?
Yeah, it is. It is. But the one thing that we want to make sure that we don't slip is that a year from now or a couple of years from now, we don't pull back on the funding of the maintenance of the stockpile, because there are things that you put into stockpile that expire and you have to replace them.
The pandemic has put an enormous strain on the healthcare system, on doctors, nurses. Are you concerned that just the burden of the pandemic is going to diminish the interest of people becoming doctors and nurses?
The real heroes and heroines of this are the healthcare providers, the doctors, the nurses, the respiratory therapists, and others who've really been knocking themselves out for 3 years. We've got to do things to help them. We've got to give them relief. We've got to get them better pay. We've got to understand the mental health consequences of the stress and the strain of that kind of job. There are a lot of things that we can do. This has been a very, very stressful period for those individuals.
And with the rise of disinformation and misinformation, are we developing an anti-science animus in society?
The answer is yes, the short answer to your question, Andrea. But the other thing is that there's so much misinformation that we're experiencing the normalization of untruths, where there's so much disinformation that's spread predominantly through social media that people just get so used to the untruths that it becomes normalized, which is really bad, because then you don't push back against it. You say, well, that's just the way it is. That would be a terrible blow to society, and I believe to our democracy, if all of a sudden people say, well, what's the use? There's so much untruth out there, we might as well not even push back on it. It's hopeless. We've got to not accept the normalization of untruths.
You've had work on AIDS, on Ebola, on COVID, to say, not to say all the other things you've worked on. What are you proudest of?
Certainly in the arena of HIV/AIDS, that I directed the Institute, and still do now, that was responsible, together with collaborations with the pharmaceutical companies, for developing the whole array of life-saving drugs that have led to literally having people with HIV live a normal lifespan, which has saved millions of lives. And I'm also proud of the fact and humbled by the fact that I've had the privilege of working with President George W. Bush to be one of the architects of the President's Emergency Plan for AIDS Relief, or PEPFAR, which clearly has saved now, over 20 years, about 20 million lives throughout the world.
You're going to be 82 on Christmas Eve.
Correct.
What's next for Tony Fauci?
Well, the next chapter in my life, and I want to be able, and I will, do things outside of the venue of the United States government as a private citizen, in teaching, in lecturing, in writing, hopefully getting back to the conversation we just had, to inspire younger people to go into science, and for those who are in science, to inspire them to continue what they do in the realm of the health of the American public, and hopefully some in public service, like I've had the privilege of doing for almost 60 years now.
I mean, it's really extraordinary, 60 years. What are you going to miss?
Mostly the people. It's just an extraordinary group of people. It really is a shout out to government service. The people at the Department of Health and Human Services, the people at the NIH, where I've worked for 54 years, the collegiality, the spirit of people really devoting their professional lives to serving the public. When you're in the health arena, it's to serve the public by helping to preserve and protect the health of the American public. And that's a great feeling of satisfaction and gratification when you know what you do when you go to work might help someone with their health, prevent or treat an illness, prevent them from premature death. Those are the things that give you a great deal of gratification and good feeling. That's what I'm going to miss the most.
You're not going to miss the Senate hearings.
Well, some of them are rather pleasant. Others are not. When we're giving our case and we get a good appropriations, those are really friendly and good. But sometimes, you know, you get a little bit pushback, as it were.
Would you consider public service again?
Oh, yeah. If I had to do it over again, absolutely. 100%. 100%. And I recommend it for people. It's not for everyone, but if you have the slightest inclination for it, it can be a very, very satisfying and fulfilling field.
Thank you for everything you've done.
Appreciate it. Good to be with you. Thank you for having me.
Well, come on back with the book or whatever it is it's going to be.
All right. I will.
It's not the last we're going to hear from Tony Fauci.
Thank you.
Thank you, Doctor.